In this video, we're going to talk about wounds, and we're going to be able to describe wounds and all of the different aspects and materials that you would use to take care of a wound. Okay, so we know that the skin is an organ of protection, right? So any breakdown of that function of the skin, that is a wound. It is the loss of continuity in the epithelium with or without loss of underlying connective tissue, whether it be muscle, bone, or nerves. This wound is created by an injury to the skin or the underlying tissues and organs, caused by a surgery, a blow, a cut, chemicals, heat, cold, friction, a force, or a pressure, as a result of a disease or an ulcer. So any injury that causes that protective function of the skin is considered a wound, right? Whether it be a skin or a tissue. Okay. So here we have different concepts. The first one is a bandage. And a bandage is a long piece of soft cloth that you tie around an injury. We saw this in the previous section, right? A discharge is a liquid that comes out of a wound. Okay? It could also be a different type of discharge. It could be a discharge from different parts of our bodies. For example, it could be a vaginal discharge, any other type of liquid that comes out of somewhere, okay? We have a dressing. A dressing is a covering that protects the injury. We also have a picture here of a Caesar salad dressing, but although both of them are dressings, we have to make sure that we understand that one is a salad dressing and the other one is a wound dressing, okay? The next picture, we can see that it is inflamed, right? We see a wound that is inflamed. And when a wound is inflamed, we could say that it's red, it's painful, and it's swollen. It might be hot as well, or it might not, but we can see the picture of the wound that's inflamed. And the last picture, we have the term odor. Odor refers to a smell, okay? And usually it's not a very pleasant smell. And in this case, we would use the word odor to describe an unpleasant or a bad smell of a wound that would usually indicate that that wound has been infected. The different terms that we have in the different pictures. In the first picture, we have a picture of pus. And here we can see pus is a yellow substance that comes from an infected part of the body. Okay, the next picture are sutures. Sutures are stitches that are used to sew up a cut or to sew up that proximity of the skin, okay? The next picture is tissue. We know that tissues make up our cells that make up organs. In this case, our organ is skin, right? So the tissue are those cells that make up the skin. We also have a different picture. I just popped it up here, which is, this is also, this Kleenex, the tissue, the tissue paper is also called tissue. And so we need to make sure that we know there are two different words that have the same, it's the same word, but they have different meanings, okay? And we have a wound, which is, like we mentioned earlier, an injury to the skin. Here we already mentioned that this wound is inflamed, which is either red, painful, and swollen. And here we have a stoma, right? We know this is a stoma. However, we need to understand that the surrounding skin of the stoma or of any wound, the surrounding skin is that skin that is around the wound. In this case, it would be all of this, right? All of the skin around the wound is the surrounding skin. Put the terms with the meanings. And number 1, we have bandage. Repeat it after me, okay? Bandage, discharge, dressing, inflamed, odor. This is a little bit tricky because it sounds like order, but it's odor. Pus, surrounding skin, sutures, tissue, and wound. Okay, so in this section, you are going to listen to an audio of a nurse who visits a patient at her home. And you're going to answer true or false, okay?
4.1.
Morning, Mrs. Briggs. It's Angela. I'm here to do your dressing. Can I come in?
Hello, Angela. I didn't hear the doorbell. Come on in.
I'll just take a quick look at the wound to see how it's doing.
Thank you. I'll put my leg up for you.
That's good. I'll take the bandage off first. Well, it looks much better, doesn't it?
Oh, it still looks awful to me.
Actually, the skin around the wound's less red.
Yes, I suppose so.
The wound's got less pus in it.
Oh, well, that's good.
It doesn't have a bad odour now because the infection's better.
I noticed that.
The wound's a bit smaller too.
That's good news, isn't it?
It certainly is. Right, I'll do the dressing now.
Thanks, Angela. I'd like to have a shower.
Alright, so the correct answer for number 1 would be the wound looks much better. This is true. For number 2, the skin around the wound looks redder. No, it actually looks less red. That's what the nurse mentioned. For number 3, the wound's got less pus in it. For number 4, the wound doesn't have a bad odor. That's true. And for number 5, the wound has got a lot bigger. That is false because she mentioned that the wound was getting smaller. Okay. In this slide, we have 4 different pictures of different wounds. Okay. So to describe the first wound, we would say that the middle part has got a large area of dead tissue and it smells bad. Okay. For the second picture, we could say that this wound has a lot of greenish pus in it and the surrounding skin, so all of the skin surrounding it is red and inflamed. And it's got quite a bad odor. Okay, so we could probably say that this is infected, right? Here we have the third wound. We can say that the stitches are healing well and the surrounding tissue is healthy and it doesn't smell. And here we have the fourth picture. We can say that there's a moderate amount of bloody discharge from the wound, but it doesn't have a bad odor. Up some sentences with the proper word. So number 1, the wound is healing. There's a lot of healthy tissue. So we have that the wound is healing, and healing with healthy tissues, that would be the proper word for this particular sentence, okay? Number 2, the patient is bleeding after his operation. There's a lot of blank in the wound drain. So in this case, we're saying the patient is bleeding. So there would be a lot of what in the wound drain? It would be blood, okay? The third question is, there is a large area of blank in the middle of the wound. It has quite a bad. So the first space, we would say there's a large area of dead tissue in the middle of the wound, and it has quite a bad smell. For number 4, we would say the infection is clearing. There's not much blank in the wound. So if we say that the infection is clearing up, there's not much. In this case, the word to fill in the blank would be pus, okay? The next sentence, it says, the blank is healthier. It doesn't smell. Okay, so what word could we use? It would be surrounding tissue. So the surrounding tissue is healthier and it doesn't smell. Number 6, the sentence says, there's a moderate amount of blank from the wound. There's a moderate amount of bloody discharge. We saw this in the last slide. Number 7, the wound has a lot of greenish pus. That would be, or we could just say pus in it. And number 8, the skin is still. Our word left to fill in this space would be red and inflamed. So the skin is still red and inflamed. Okay, and just to sum up, we have we have a table of 2 different sections. The first section is regarding to what the phrases that we can use to say that a patient is improving. And the next section is to say that the patient is not showing any improvement. So here we would say the sutures are healing well, or the surrounding tissue is healthier. To say that the patient isn't healing well, we would say the middle of the wound still has a large area of dead tissue. It smells bad. There's a lot of blood in the wound drain. There's a large area of dead tissue in the middle of the wound. Or it has quite a bad odor. The wound has a lot of pus in it. And the surrounding skin is still red and inflamed. We can also say that the wound, it's getting worse. It's looking worse. It's not getting better. And now to say that there is improvement, we can say that the wound doesn't smell, that the wound is healing, that there's a lot of healthy tissue, that the infection is clearing, and that there's not much pus in the wound. We can also say that it's getting better, that it looks much better, or that it's doing quite well. So these are the phrases that we would use to say whether a wound is improving or whether it's not improving, okay? So just take a moment to practice saying these phrases to describe when a wound is getting better or not, okay? So that would be the end of the video and the lesson on wounds.